More and more people are discovering just how transformational having a meditation practice can be. Even in psychology, if you look at third generation cognitive therapies, metacognitive therapy and acceptance and commitment therapy, you will see that in addition to the typical cognitive behavioral approaches, there's more of a meditative flavor in terms of learning to really see thoughts as thoughts. Now, I want to invite you to a seminar that I'm doing. It's about how to apply meditation techniques and practices in actual client work. Because here's the thing, most of the people who study meditation and who are taught meditation learn it in a spiritual context by meditation teachers whose context is spiritual spirituality and inquiry into the nature of experience. Now, I started doing meditation back in 1991, and I started studying NLP and hypnosis in 1997, and I've seen clients professionally since 1998. So I've balanced having a meditation practice and seeing clients throughout all those years. And what I've learned to do is I've learned to teach and adapt meditation techniques to clients in the change work setting as relevant as to whatever they are there for. Because let's face it, most of your clients are not meditators and they will not have a long-term meditation practice. And then the question becomes, how can you tailor make meditations that facilitate insight and cultivate skills relevant to a person who might have no interest in spirituality, philosophy, be a meditator, or be interested in a meditative practice? How do you adapt this stuff to people who depress, people who do OCD, people who anxietize, people who struggle with chronic pain? So in this particular seminar, it's going to be about how you can tailor make meditative practices for clients who are not meditators. How to troubleshoot, how to deal with the typical objections that may come up when people attempt to do these sorts of things. Also, how does hypnosis, suggestion, and social psychology factors play into all of this? How do you combine suggestion artistry, social psychology, and Eastern meditative practice to help the modern and postmodern client? Something else as well, quite a few people who begin to meditate, even people who use apps, have what you could call adverse effects from meditation. This is not just true for people who do long retreats, but it can happen the very first time someone meditates, and for people who do meditation in low and short doses. So there's quite a few adverse, destabilizing type of experiences that people can have, such as depersonalization, derealization. As a matter of fact, many of the typical subjective phenomena that people report when they are breaking down or melting down might not be that different from some of those that people might experience when they claim to be waking up. So how do you handle that? How do you handle people having these adverse types of experiences while doing a meditative practice? How can you offer frames and guidance so that these experiences can be turned into something that's constructive and transformative for that particular individual? And also, when meditation processes might be contraindicated, when not to use them. So hopefully, I'll see you there. Thanks for listening.